Hospitals are overwhelmed and worried about what could still be coming. Despite that, though, Governor Whitmer has refused to issue any new restrictions.
So those restrictions in the first waves were put in place to try to keep Michigan's hospitals from going through what looks to be happening right now. And this time the numbers are just as bad, and as we've just showed you, getting worse. Grant Herms has been looking back at the governor's past reasons for shutting things down and the argument that she and others are making that this is different this time. Grant?
Well, Kimberly, Devin, things have changed over the course of the pandemic, like what we know about how the virus spreads, the treatments, and of course the vaccines. But there are some striking similarities between what's happening now and back then, starting in March of last year.
This will be temporary. This intervention is important to buy time so we can create surge capacity in our hospitals.
Just 10 days later, Michigan would hit its first daily case peak of just under 2,000 cases. 7 months later, Michigan was heading into the holiday season, and cases began a steady rise into the thousands each day. After a summer and fall of political fights, threats, and a lack of compliance with social distancing, the governor, citing science and national models, called again for more restrictions.
These steps are what the public health experts say we must take to avoid overwhelming hospitals and death counts like we saw in the spring. The rapid spread of this virus requires that we take aggressive action now to save lives.
Just 5 days after that, Michigan would have its highest daily case count of the pandemic, 9,779 cases. Michigan's late 2020 pause has been widely praised, and at least one study from Imperial College said it helped save thousands of lives. But as the state creeps towards that record case count, the governor has changed course, opting instead to lean on vaccination, therapeutic treatments, and calling for more personal responsibility, despite similarities to the spike in the fall.
Instead of mandating that we're closing things down, we are encouraging people to do what we know works. That's the most important thing that we can do. It's not the policy problem, it is a variant and compliance problem.
But the health experts don't agree. The heads of the NIH and CDC saying Michigan will not be able to vaccinate its way out of this latest spike.
Close things down, to go back to our basics, to go back to where we were last spring, last summer, and to shut things down.
And hospitals with a warning today that personal responsibility may not be enough.
I think that the people who are going to do the right things are already doing the right things. And the people who are not doing the right things will not do the right things. And so I think some of that is preaching to the choir, unfortunately.
So, Grant, the question a lot of people are asking then in all this is why?
Well, Devin, frankly, we just don't know. What we do know is that the White House said they're not going to play whack-a-mole and send more vaccinations to states that are hotspots like Michigan is right now. We also know that the governor, for the first time, her favorability numbers dropped below 50% last month, as a lot of folks are looking ahead to that election in 2022. What we do know is the things that work, all the stuff we just heard Dr. Frank McGeorge talk about. But the question now really is, are people going to do those things? We'll have to wait and see.
Yeah, absolutely. All right, Grant.